Laparoscopic cholecystectomy is one of the most common operations done in the United States. It involves removal of the gallbladder through small incisions and using a small camera to watch your instruments do the work. This is the liver, the stomach, the gallbladder, the pancreas, and large and small intestine. The gallbladder can have several problems, either not contract enough or contract too much, or it can get stones that block off its outlet. Those stones can become blocked in there, which can cause acute cholecystitis or a bad infection. The stones can also get blocked further down at the outlet where the bile ducts come into the small intestine and back things up into the pancreas, which can cause pancreatitis. Bile is made here in the liver and comes down here and goes into the small intestine where it helps emulsify or digest fats. Excess bile refluxes back up and sits in the gallbladder until after you eat, and it's then stimulated to contract by a hormone called cholecystokinin. When we remove the gallbladder, we divide here and take the gallbladder and all its contents, including any stones or polyps that are in it. This leaves the normal progression of bile out of the liver and into the small intestine, so most people don't notice any deleterious effects after their gallbladder has been removed. So there are many different types of surgery for weight loss. In particular, this one is known as the sleeve gastrectomy. Your diaphragm comes across like this and separates your chest from your abdomen. The esophagus comes through the chest and connects with your stomach in the abdomen. The sleeve gastrectomy is performed by removal of what's called the greater curvature of the stomach, or this portion. This then narrows this portion of the stomach, which allows you to feel full sooner, and also takes out neurotransmitters that are responsible for hunger in the portion of the removed stomach. So there are several different types of weight loss surgery that are done in the United States. We perform them laparoscopically through small incisions. In particular, the Roux-en-Y gastric bypass is performed when the upper portion of the stomach is divided and a piece of small intestine is brought up and sewn into the stomach. As this pouch fills, you feel full sooner, and then the small intestine is rerouted and reconnected to the small intestine closer to the colon. That bypasses the majority of the small intestine, allowing weight loss through both a malabsorptive action as well as a restrictive component.